Dr. Brandon, let's talk macular degeneration. Explain us what it really is and how it affects us people if we have it. Can it be prevented? Can it be fixed after we have it? All that good stuff.
Well, macular degeneration isn't the best news. It is age-related. It usually would be at 50s or older, 55 or older, for people to start having that. On a routine eye exam, a person that has it, they might still have 20/20 vision, but as a doctor, when I look inside the eye, I might see some little yellow specks around the part of their anatomy called the macula. The macula is one of the most important parts of your eyes because you use it when you look at things. That's the main part of your eye that can see 20/20, the only part really that can see as small as 20/20. Your side vision is just kind of blurry if you think about it. When you look at something and pay attention to it, that's where you have 20/20. So if a person gets macular degeneration and start to lose vision because of it, they kind of like have a cookie cutter out of the middle, a vision that's not very usable. They would still have side vision, and therefore they would be able to get around and move through space, but they wouldn't be able to, look at pictures of their loved ones and see the detail, or look at their loved ones' faces and see the details on their faces. So that makes it hard. They would have a hard time reading.
I see.
Can it be, if I saw those little speckles, or if I knew that you had a family history of someone, your grandma or grandpa or your mom or dad had macular degeneration, or if you had a new diagnosis yourself, I would teach you to protect your eyes from the ultraviolet light. You'll hear that often because it also works for preventing cataracts and some other things. I would recommend that you did not smoke, that you would do things that are healthy for your heart, like get routine exercise as simple as 20-30-minute walk a day, eat lower fat diet, and when you do eat fat, eat the healthier fats like olive oils and things like that. And let's see. And then eat healthy, especially the dark green and leafy vegetables like spinach and kale and collard greens, at least 5 servings a week. Like red things like tomatoes and beets and watermelon. Those are very healthy. And yellow and orange things like carrots and winter squash and mango, things like that.
I see. So that's good news, and that's wonderful in the eating part. So what about when all that doesn't work anymore, or whatever it is? Is there also surgery treatment or other type of treatment, glasses, lenses, which help out with that?
Well, there's stages to macular degeneration, and the dry form is what most people start out with, and then sometimes it progresses to a wet form. So if you're in the dry form, we would give you Amsler grid, which is kind of like a graph paper that you look at, and if the squares start to look distorted, it would help you to know in between eye exams that you may be going to the wet form, and the wet form can be treated. At that point, as an optometrist, I would refer you to a retinal specialist, an ophthalmologist who specializes in fixing those kinds of things. And right now they do injections that have been shown to improve vision if you have lost vision maybe by a couple lines. It's probably not going to be perfect vision, but at this point, better vision is better than worse vision. And keeping it from progressing is better too.
Right. And would it be stable also? Would it be like just for a few months, or would it be for like a long period of time that those injections work?
Usually the people have to continue taking the injections until the retinal specialist feels like it's stable.
I see. Those injections, where are they given? In the eye or in somewhere else, or like actually
in the eye?
Doesn't sound too comfy. So, all right.
So prevention is good. Eating right, and if you don't always eat that way, there are also supplemental vitamin type things, including the antioxidant vitamins that I mentioned in a different video, like vitamins A, C, and E. This time zinc and omega-3s also are helpful, and copper. Formulas that say ARED, the ARED formula, those are beneficial to slow down the progression of loss of vision, and to slow down, like if you only have it in one eye so far, the onset into the second eye, studies show if you're on a supplement like that, or at least eating healthfully, those are the things you can do to try to slow it down or stop the progression.
So what about the dry stage, which is the lesser stage, then comes the wet stage. What are the other stages called, and what can we do there?
Well, those are mainly the two stages.
Oh, I see. Okay. I thought there was, for some reason I thought there was 4 or so, but those are the 2 stages. All right. So, no surgery. Again, when we hear about LASIK surgery, we're not talking about macular degeneration surgery.
No.
Okay. All right. Well, that's good. Okay. So, basically,
as far as glasses, when a person, we optimize the vision with glasses, and then there are what they call low vision techniques, types of glasses or binoculars that can be used, or magnifiers that can help a person be able to see as well as possible. So one reason you want to slow down the progression, or get back a couple lines, is because the least magnification you can use to get the job done, it's a little easier to use your vision. So the more big you have to make the letter to see it, it's harder to use, because imagine seeing a word on the paper. If you only could see a couple letters at a time, you really have to think and spell out the word. You can't just look at the word and know what it is. So if you can see at least a whole word or a couple words at a time, because you don't need as much magnification, it's the simpler low vision way to be.
I see. So it can go so bad that actually you need to magnify it so large that you really can only see 2-3 letters, so you'd never mind about seeing a page or a whole line?
Right.
Wow.
Some people get that bad.
Wow. I haven't realized that. Okay. Thank you very much, Dr. Brandon.
You're welcome.